So welcome everyone. Happy November and to our late fall mini medical school. And we are delighted to be partnering for the first time with Beebe Healthcare for this series. And so here we go. Um, whoops. So first off, you can follow us at delawareminimed.org, and then with our partner, Sussex County Health Coalition, at sussexcoalition.org. You've got the YouTube stream up in the chat, or you can just go to Delamed, youtube.com/Delamed302, and then it'll show the live stream right there. For those of you who are new, this is the only time we'll do this particular slide. The Academy of Medicine and Public Health was founded in 1930. This is funded by the Academy and by the American Rescue Plan Act funding that came as a result of the COVID-19 pandemic. There's no continuing education value for this. So if you are a professional, there's no CE value for this. You can attend as many of the mini med sessions as you would like. If you're going for a certificate, you may only miss, well, you can't miss any sessions. You can miss one and do one makeup. We will send you a certificate if you satisfy that requirement. If you're not able or interested in attending all of them, there's a self-signed certificate, and those come out about a month after the series is done. There are no grades and tests. However, if you do a makeup session, Nicole Sabine, who handles that, will ask you to answer a couple of questions based on the video that you see in the presentation that we posted at delawareminimed.org. And let's see. So why do we do this? We want to enhance health literacy in our community. And we're delighted that so many of you are middle, junior, high school students, undergrad. And we want to expose you to a whole bunch of different careers in healthcare, different types of medicine and medical practice and degree types. We want our presenters will be sharing, what their career pathway was with you. And importantly, this is an opportunity for you to interact with healthcare providers when they're not about to give you a shot or, any of the number of things that healthcare providers do that are important for us. So this is sort of a safe space. This is a Zoom webinar. You don't see each other. We don't see you except for your name, so you don't need to have your camera on. And in fact, I recommend that you turn your camera off anyway. It'll save on bandwidth. Use the Q&A feature, not the chat, if you have any questions. Remember, don't ask questions of a personal nature or about somebody in your family. We'll have to sort of de-identify them, but privacy is a very important thing here. All questions will be answered given our firm stop at 8 o'clock. If you've got housekeeping questions, throw them right in the Q&A. Christy and I will take care of it. You do need to stay through the entire presentation, but once the Q&A starts, you're welcome to leave. You will be counted as present. So at this point, I'm delighted to turn it over to Christy Handley, my co-host with the Sussex County Health Coalition. Christy, over to you.
Great. Thank you, Tim, and welcome everybody to our mini-med late fall session. We're excited to have each and every one of you. And we're excited to partner with Beebe Healthcare as well. A little bit about Sussex County Health Coalition for those of you who have not joined us in the past. We are an organization in Sussex County that engages with our communities to make sure that we are raising awareness of health issues that may be prominent within their communities. We raise the voices of our communities to make sure that their concerns and ideas are brought to the forefront. And we do that by engaging with them in their communities directly and involve them in all that we do. We also develop and mobilize community resources. We do a lot of workforce development and training to ensure that some of our folks have jobs and have training to get them into those positions and to upskill them into other positions that they may be looking for, such as nursing. We also have supportive collaborative efforts to improve our communities. And then we do evaluations and we report out on all of the impact that we have within the communities that we serve. Next slide. So this is what our schedule looks like. And Tim will, that's okay. This is what our schedule looks like for the early fall session. So we start today, then we have a session on the 12th and the 19th, and then we skip a week for the holiday. We have December 3rd, 10th, and our last session will be the 17th. And tonight we are excited to have Alison Watson with us, who has been with Beebe Healthcare for the past 16 years. She started in the emergency department. She transitions to a nurse educator, and I'm going to turn it over to Alison to give us a brief overview.
All right, Alison, your turn to share.
Hi, everyone. Thanks for having me. Thank you to the Delaware Academy of Medicine and Public Health for hosting and the Mini Med School. This is really fantastic that so many students in Delaware are able to see all the interests and professions in health professions that we have. I'm really excited to talk to you today about nursing and Beebe Healthcare, and specifically what nursing looks like. Sorry, I'm just going to minimize the people because that's all I see. I'm really excited to see how Beebe and nursing and how that looks like for you. I travel a lot up and down the states, specifically in high schools. So I really hope that I've already connected with a few of you, but if not, I hope there's new people that I meet tonight. So today we are going to discuss from classroom to care, how Beebe teaches tomorrow's nurses. So a little bit about me and my role as a nurse educator here at Beebe. Like some of you, we could have similar backgrounds. I'm from Sussex County, born and raised. I went to Sussex Tech High School. I went to Beebe School of Nursing, which is now named the Margaret H. Rollins School of Nursing. I earned my bachelor's and my master's from Wilmington University in nursing, and then I earned my doctorate in education from Wilmington a little later on. With that, I'm a certified nurse educator and an emergency nurse. So emergency background is my passion. But with that, it's really, I've been at the school of nursing now for 13 years. Prior to that, I was in the emergency department, and I still continue to work in the emergency department. So you can't really get me out of there. This is just to show from nursing school to doctorate defense. So everyone has a journey, and that is the beauty of nursing, is that you can continue to grow in many different facets of nursing. Looking at that as I started my career, and like many of you, you're looking at how you're going to start your career and how you're going to get involved. And there's so many opportunities from the high school setting and volunteering. When I started nursing school, I did have my CNA, so I was able to work with that and became an extern while I was in nursing school. So that really was able to get my foot in the door and do extensive job interview, essentially, because people are seeing what it's like to work with you as a team. And even in the volunteer aspect, you make so many connections in the workplace that really you can utilize in the future when you have your degree or your certification for what you're interested in. And then, as I mentioned, I started in the Beebe's emergency department. I've now been a nurse educator at the School of Nursing for the last 13 years. And with that, nursing really evolves. You can be so many things in nursing. So outside of only teaching nursing students, I'm very involved in student nurse recruitment. So that's a unique aspect of my job, because with that, I am able to go to high schools, college fairs, and talk about all the opportunities that we have in nursing, specifically in Delaware, and more importantly, at Beebe Healthcare. So what is a nurse educator? Many people may see what teachers are, especially in high school. A lot of your teachers in high school are nurse educators as well. Oftentimes you'll see this as an experienced nurse with additional education. A big part of our day is designing and delivering curriculum to nursing students. So for example, right now I'm in the senior semester. Our students are doing special populations. So I have students personally in the emergency department. We're giving IV push medications. We're doing procedures. We are starting IVs. So very unique, while another student may be doing their inpatient mental health clinical. The other ones during the semester may be at Beebe delivering babies in the women's health department. So What's really nice about specifically Beebe's program is that we are very clinical based and we're hospital based. So our students have lots and lots of clinical experience. Another part of the job of being a nurse educator is overseeing clinical practice. So we are right there with our students at all times, overseeing their practice and nurturing and mentoring them to transition to practice. We stay updated on evidence-based practice. So many of us are still at the bedside as well, but we ensure that what we're teaching is what is current practice. Act as a mentor. So that is actually probably one of my favorite parts of the job, is really mentoring students to transition into practice. And I'm very fortunate because I also still work in my specialty. So I actually get to work with many of my previous graduates. So that's always very rewarding. Some nurse educators are very heavily involved in research. And what's another unique thing that I get to participate in is evaluating educational programs. So not only am I evaluating Beebe's program constantly, but I also have the ability to go to other schools and colleges and look at their programs, look at their outcomes. What do they do? What can they do better? And I do that with the ACN, so the accrediting body for many nursing schools. So that's a really unique experience as well. When you look at nurse educators and where do they work, as I mentioned, I work in a college system. So when that looks like an RN specifically, some may be in baccalaureate programs, others may be doing advanced degrees like a master's or a doctor prepared. So that's one place where you may see nurse educators, maybe at the bedside doing clinical. Others could be strictly online. Others may be in the classroom. High schools, many of you are in health professions or allied health pathways. So a lot of your high school and even middle school instructors are nurses. Not all, I know there's other allied health professions, but many that have allied health pathways or health professions pathways are nurses. Other types of nurse educators you may see are even in the healthcare system. So you'll see clinical educators. So they're based specifically in a department and they are the expert to teach staff. And then other ways that you may see nurse educators are on those online platforms. So people ask me all the time, how did you become a nurse educator? How did you get into that role? And I do think that I always wanted to be a teacher growing up. I had all the pretend play for that. But when I went to Sussex Tech for high school, I actually did the pathway of media broadcasting. I really was intrigued by that. I was on the Raven Report. And I also realized I did not want to do that for my profession. And I really honed back into what I really went to Sussex Tech for, and it was the pathway of health professions. But truly, that is the beauty of nursing, is that was critical in part of my role now with public speaking and going into schools, trying to recruit, making relationships. So I really think that there are many different strengths when it comes to being a nurse and the variety of specialties and areas that you can be a nurse. I was with a teacher today and she made the comment, if you're interested in law, you can be a nurse. If you're interested in marketing, you can be a nurse. If you're interested in education, you can be a nurse. There's so many just varieties that involve nursing. So with that, preparing to be a nurse educator, what that looks like, some people always ask me, how do I get to the school of nursing? It used to be you had to really wait for someone to retire. But at this point that it looks a little different. But I think a lot of ways to start are precepting staff, because that starts your foundation of teaching others, seeing how different people learn, what are different approaches that you can have to help different learners, because not every student learns the same exact way. Sometimes that also helps us have compassion and empathy and see it through a different lens. Continue professional development. I think that's really important, that you continue with your continuing education. Degree progression. Most nurse educator roles do require a master's prepared at entry level. And if you are in an area of specialty, which every area in nursing is a specialty, become certified. You see that's a really big trend, that people have credentials behind their name, certified in the specialty that they work in. And it really just shows that you're an expert in your field and that you've dedicated the time and the knowledge and the education to really learn more about that. So I think that's always, once you have 1 or 2 years of experience, to go forward and continue your certification. Another way how I really started in the education role was I took a part-time job first doing clinical. Do I actually like this? Do I want to work with students? And I think adjunct roles are very readily available to see what it looks like from a clinical standpoint and being at the bedside with students. So I think adjunct roles are a great way to see if you are in the preparing to be a nurse educator. And then leadership. If there is ever any committees or council, shared governance, and you have interest in it, or your manager thinks that you should have interest in it, someone once told me when I was younger, just say yes. And honestly, saying yes is what opens up many doors for you. It makes networking better. You meet new people. You see maybe different specialties that are all coming around the table together. And when you come around the table, you see different ideas and perspectives from people that you usually wouldn't sit with. So I really would promote that too if you're interested in the nursing education role. But with that, there's lots of opportunities in nursing. I think that's why I'm so passionate about nursing as a profession, because no matter where you are in your life, or maybe your passion changes, maybe your interests change, or maybe it's so much of your interest that you advance your degree and you become an advanced practice involved in nursing. So with nursing, just some examples that you might see, and maybe you've already thought about it from a specialty standpoint, is there's emergency, critical care, labor and delivery, mental health, oncology, cardiac, medical, surgical, so many specific departments in the hospital. If you went into a hospital and looked on what floor is on each unit, you would see a variety of specialties in the actual inpatient setting. There's also nurses that go into the home. Not everyone needs to be in the hospital. So there's home health nurses. Many of you have met your school nurse. So school nurses, they have a lot of autonomy. It's them and another nurse, depending on how many students are in your school. And they really have to have really fantastic assessment skills, because they are the eyes to determine, does this student need additional care, or what if a critical event does happen? Now we do see many students that have other maybe comorbidities or diabetic or things that really require a nurse every day. So that is also another option when it comes to the nursing profession. What you're going to learn about in later sessions is Beebe's population and community health. So we specifically have a RV that goes out into the community and pop up at areas that maybe need additional resources or that are rural. And that is also a great way that we can help members in the community who may not have access to care as readily. So community health and population health. I've mentioned a lot about the nurse educator role. So whether that's in high schools, colleges, or even in the inpatient area, there's clinical nurse specialists. And with clinical nurse specialists, they actually have prescribing rights. Nurse practitioners, off the nurse practitioner umbrella, there's a variety of neonatal nurse practitioner, mental health nurse practitioner, family nurse practitioner. There's a variety of arms off of that. In Delaware now, University of Delaware has just announced their nurse midwifery program. So another opportunity in Delaware for maybe students that have an interest in advancing their degrees and specialty from nursing. Wilmington University also just started their nurse anesthetist program. So another huge win for Delaware and what that looks like of advancing care and professionals in our area. There's also professions like nursing leadership. So chief nursing officers, nurse managers, lots and lots of opportunities to grow in the profession. And then lastly, another one that's unique that a lot of people don't know about is a legal nurse consultant. So that is someone who's interested in law that may review charts and cases and sees if there's areas for litigation or review. So that's also a really unique specialty when it comes to nursing. And today I was at a local high school, and many of them brought up forensics, which I don't have listed here, but forensics and nurse examiners are also a specialty of nursing. So if you want to be anything in the world, you can still be a nurse and be that. So enough about me and nurse education. What does it look like to be a day in the life of a nurse? So I have a case study here on what this looks like to potentially be a young nurse on a med surgical unit. So this is Nurse Jamie, a staff nurse on a medical surgical unit, working the 7 a.m. shift. It's a 12-hour shift at a local community hospital. Nurse Jamie has been working as a staff nurse for 3 years. She cares for adult patients recovering from surgeries and illnesses. Her day is full of assessments, teamwork, and patient care. It's at 6:30 a.m. So your shift starts promptly at 7, but it really starts before that. So she arrives at 6:30 in the morning to get bedside report, which is really a staple of nursing, is you are integrating the patient into the care and getting reports so then the patient can actually be involved in that process. So Jamie arrives 30 minutes early to prepare for her shift. She listens to the bedside report from the night shift nurse. One of her assigned patients is Mr. Lee, who is post-surgery from appendicitis, so had an appendectomy. Another is Mrs. Grant, who has diabetes and a wound on her foot. So the first question would be, why is it important for nurses to get a detailed report before starting their shift? So what if we just, the other side of this would be us just going in blindly and not getting that handoff report. So I think that it's really important that we get all that information. And from a nursing standpoint, we use a mnemonic called SBAR. So SBAR is a way that we can, in an organized fashion, ensure that we're getting all the information from the patient and from the ongoing and offgoing nurse, because nursing is a continual job. So we want to make sure that we're getting all the right and accurate information. So with this, SBAR is situation, background, assessment, and our recommendation. So if we're using Mrs. Grant as an example, situation. So what are some things that you would think is the situation for Mrs. Grant? So if you have additional information, she's a 78-year-old female admitted for uncontrolled diabetes and a left foot wound. Her background, she's a diabetic on insulin, but did report to another staff nurse that she has difficulty taking her blood sugars at home. She doesn't know how to use the machine. It's hard for her to see the number. She doesn't like giving herself a little prick in her finger. She also has a history of hypertension, and she has a history of diabetic neuropathy. So a condition that's common with uncontrolled diabetes where she can't necessarily always feel sensations in her feet. So if you think about where we live, what that looks like, maybe in the summertime when people come and vacation and they go out on the hot beach and the hot sand, and most of us are jumping across the sand because it's burning our feet. Someone that has diabetic neuropathy may not have that same sensation, and they could come in with significant burns to their feet. For assessment, the wound to the left foot needs an infectious disease consult and wound care, possible surgical debridement. So that is the assessment that they're mentioning about this wound. And then the recommendation is a wound care consult, the patient going on strict sliding scale insulin to control their blood sugars, and potentially a home health consult when they're discharged from the hospital. So this would be a very brief example of what it would be like to get a report from your patient from the offgoing nurse. And then you would do this for all your patients. So depending on what type of specialty area you're working on would be what the nurse to patient ratios are. As we continue our day at 8 a.m., we do our morning rounds. So we're going in and checking on our patient. Jamie checks on Mr. Lee. He's the post-appendectomy. He looks pale, says his stomach hurts, and his temperature is 101.3. So we're worried about him. He's post-surgical, and now he has a fever. Mrs. Grant says she feels dizzy. The certified nursing assistant collaborated with the nurse, and she said her blood sugar is 62. So if we think from a nursing standpoint, we need to know what our normals are. So if we know that a normal blood sugar is 70 to 110, 62 would be low. So we need to give Mrs. Grant something to elevate her sugar. Next, the next nursing decision may be, can she swallow? Is she alert enough to do that? So Jamie notifies the doctor about Mr. Lee's fever and gives Mrs. Grant some juice per her hospital protocol. So another thing that's very heavy in nursing is nursing-driven protocols. So things that you can do without a physician's order using your discretion and your autonomy and assessment skills. So if we kind of think for a moment, what might be causing Mr. Lee's fever? He had appendicitis, but we took the appendix out. So we should have taken that infectious process away. So other things, that we can think of. Does he have a post-op infection? I may want to know, was his appendicitis ruptured? What does his incision look like? So does his incision look infected? Is it red? Is it draining? Does it have a foul odor? Maybe an abdominal assessment. So those are some things as a nurse I would be thinking of just from that brief amount of information that his stomach hurts and he has a fever. At 9 a.m., we start our medication pass. So my nursing students in a little bit can really speak to that as well on the hecticness of giving all your medications to patients commonly during this 9 o'clock window. So Jamie carefully checks each patient's medication list and confirms the names and dosages and explains what each medicine is for. In nursing, one of the first things you learn as a nursing student is the 5 rights of medication administration. Some people even expand it to 10, but the 5 main rights are that you're giving the right medication to the right patient, the right dose, the right route. So is it oral? Is it an injection? Is it IV? And at the appropriate time. So did we just give it 2 hours before, or is this the right time? So asking you, what could happen if a nurse skips one of the 5 rights? I think there is a box available for you. So what are some things that you could think if a nurse skipped out on identifying a patient, their name and date of birth? All hospitals in Delaware use electronic medical records. So we have capabilities where we need to scan our patients to confirm that it's correlating with our electronic medical records. So with that, if you start thinking, some things I could think of offhand, they could administer the incorrect medication to the wrong patient or even cause harm. What if you're giving Mrs. Grant, the lady with the blood sugar of 62, what if you go and give her 6 units of insulin? That would then lower her blood sugar. So it's very important that we're not giving someone the wrong medication. Maybe you give someone who has a low blood pressure antihypertensive medications, and now that worsens that. Maybe you give blood thinners to someone who can't have that. Maybe you give a medication to someone who has a significant allergy. So it's always crucial that you're doing your 5 rights. Next, we're halfway through our day. Let's see, I'm not sure if I can see those answers, Tim, or not, but maybe others can on what would happen. So at 1 o'clock, next is another very crucial part of a nursing is communication and teamwork. So many organizations and many departments participate in rounds or interdisciplinary rounds where multiple people of the healthcare team come together to specifically talk about that patient. So maybe my perspective from nursing looks different than what case management is doing, or the dietitian, or physical therapy. So it's a good time for all the people that are collaborating in the patient's care can meet to see what are the big goals and where can we really make this patient improve. So Jamie joins the healthcare team for rounds where doctors, PT, dietitians discuss each patient's progress. She shares her observations and advocates for her patient's needs. So at this point, the doctor orders lab tests for Mr. Lee to check for his infection. So for some of you that are in high school and in allied health, what is a big lab that you might consider if he's ordering labs that would indicate that Mr. Lee has a type of infection? And the big lab that you would see of many, but one would be his white blood cells. If they were elevated, I would be suspicious for a type of infection, and that may lead to additional orders. So why is it important for nurses to speak up during team meetings? And I think that it's really important. They can affect their treatment plan, the plan of care, their discharge promptness. It's important from a nursing standpoint. You may have insight on this patient that others don't. You're taking a lot of time with them. So discharge promptness, no one wants to stay in the hospital longer than what they need to. And we also, on the other side of that, don't want to discharge people too early. New assessments or concerns. And sometimes, what the patient is verbalizing to you, you're at the bedside a lot, is not the same of the doctor who may be looking at a screen of their recent labs and what that looks like. Because the labs don't always correlate to what the patient looks like or the patient is telling you is of concern. The day is continuing on, and now it's 4 o'clock in the afternoon or 1600 in military time. And it's time for the nurse to start providing patient education. Nurses are always teaching, always providing education, but Mrs. Grant's preparing for discharge. So Jamie's teaching her how to care for her foot wound, check her blood sugar at home, and she makes sure Mrs. Grant understands by having her teach back. So that's a very common way of ensuring that the patient actually understands what you're teaching them. So if I were to go in and say, Mrs. Grant, normal blood sugar should be 70 to 110. And she says, Yeah. So with that, it's not actually gauging their knowledge and do they actually understand what you're teaching them. So other approaches would be getting her to explain what a normal blood sugar is, or what are some symptoms that her blood sugar is low. What are things she would do if she's low? Maybe before she's discharged, she checks her blood sugar at the bedside with you, so you can show her that she's doing it right. So the big thing is patient education of really does help with preventing hospital readmissions, because sometimes we could identify something very simple, like Mrs. Grant not understanding how to take her blood sugar. So now once she gets discharged home, she's having uncontrolled blood sugars, which has now led to her even having a diabetic foot wound. Our days went really quick. It's now 18:45 or 6:45. It's the end of our shift, and now we're nearing to give handoff report to the oncoming night shift nurse to continue that continuity of care. Oftentimes, it's a long, busy day, but you feel proud of the differences that you made in your patient's recovery. So we think about some key points when it comes to the day in the life of a nurse, and these are, if my nursing students looked at this, a lot of these are things they would really agree with, that they are evaluated on every day in clinical. But some of the key nursing skills that they actually demonstrate and are able to provide in the clinical setting is critical thinking or clinical judgment. So for example, the one patient had a fever and abdominal pain. So that was recognizing the signs of infection. Communication, we're communicating with many team members, the patient, the family, medical providers. So communication is crucial from a nursing standpoint, and you really are the hub. You're the one that is relaying information or escalating information to who it needs to go to. Patient education, our students know they teach every patient every day. Safety and attention to detail, things that we want to prevent while we're in the hospital. We don't want anyone's condition to worsen. Safety, things I think of are like fall risk, correct medications. We truly are there to help, not to harm. And then compassion and professionalism. So nurses are, one of the most trusted professions in the world, really, in all professions. But compassion, empathy, and professionalism is really strong suits of a good nurse. So if you had to really reflect on a day in the life of a staff nurse, there's a few questions to think about. And Tim is going to post them here for you to answer as well. But what qualities do you think make a good nurse? How does teamwork play a role in patient care? Which part of Nurse Jamie's day do you think is the most challenging? And would you be interested in a nursing career from seeing this short snippet of what it looked like to be a medical surgical nurse for the day?
And what we'll do after the presentation, I'll pull up the results. I realize that you, when you're presenting, can't see the results that are
Okay.
So we'll loop back to that.
Perfect. So take a couple seconds to see what qualities do you think make a good nurse? How does the teamwork play a role in that? What do you think was pretty challenging? So some qualities I think of compassion, very keen assessment skills. So being able to identify assessments, advocating for your patients, and that can be hard to do. Teamwork, there's so many disciplines that work together to provide patient care, and all of them are equally important. So ensuring that everyone works together timely, and then are able to provide and share their results so our patients get the best care. And I'd say one of the most challenging things from a nursing standpoint can be time management. So getting everything done in your shift and knowing that you can't always get everything done. There's busier times during med passes, or maybe your patient decompensates and needs an urgent intervention. Maybe they're going to the operating room. And other things are delegation. So from a nursing standpoint, we're working with many other disciplines. Other people that are helping us as part of the team would be a nursing assistant or a tech or an aide. And sometimes nurses really have the mentality that I'll just do it myself. I can get it done easier or quicker, or I know it'll get done, or I don't want to, they're busy too. So a lot of times that can be another way of delegation, can help your day and ultimately help the patient as well. So with that, that is a lot about nursing. For those that are interested in nursing, there are many opportunities in Delaware for you to continue your nursing degree, and Beebe and the Margaret H. Rollins School of Nursing is one of those. So I will start off by giving a little explanation when it comes to educational pathways for nursing. And nursing is unique because there are multiple points of entry that all get you to the same point. So when you start looking at nursing programs and researching colleges, what you will notice is for nursing, there are diploma programs, associate degree programs, and bachelor degree programs. All three of these points of entry get you to the same endpoint. And that endpoint is your NCLEX. Your NCLEX is the big exam, the licensure exam to take your boards to get RN behind your name. So no matter which pathway you use, all get you to the same point where you can take your boards. No matter which avenue you graduated from, you all are able to get a job in a new grad residency. So whether you come to Beebe and apply, if they saw you had a diploma in associates or a bachelor's, as long as you have that RN license, you are eligible to be hired. Another thing, you're all making the same amount of money as an entry-level nurse as well, despite having a diploma, an associate's, or a bachelor's degree. Where you see increase in pay is usually once you start getting more years of experience or you're getting in other jobs that require higher degrees in education. But just to make that clear, because that can be kind of confusing when you're starting to do your research on what does this look like. So for us at Beebe, we are a diploma program. So what that means is we are highly clinical based. What we're doing in the classroom, we're doing in the clinical setting at the same time. We are applying things simultaneously, and that really is the cornerstone of our program. But a little bit about us, we have been around for quite some time, over 100 years. So we were developed in 1921. We are an NLN Center of Excellence. We're a top-ranked nursing school. We're accredited by the ACEN, and we also have an accredited simulation program, which is really cool as well. I don't know where all of you are from, but if you're from the Lewis area, you've been to the Delaware beaches and you've came down Savannah Road going towards the Dairy Queen or the Lewis Beach, you would see Beebe Hospital or Beebe Healthcare. On Savannah Road, you still see the original hospital that was built in 1916 by two brothers and a nurse, the Beebe brothers. And with that, we've continued to thrive. So over 100 years. And in 2015, we built our new school on the campus of the hospital directly behind the emergency department. On our first floor is our classrooms. Our second floor is our simulation labs. And our third floor is even newer simulation labs. This is an example of one of our high fidelity simulation mannequins. So this is actually a student that's preparing to go to the intensive care unit. So with that, this patient is actually intubated on a ventilator, cardiac monitor, multiple pumps and drips. This patient has a central line, a wound, a Foley catheter, all things that a patient would have in real life in the hospital, in the ICU. Our students are able to simulate prior to going into the hospital setting. And what's very unique about our program is where we are hospital based, we're considered a department of the hospital. Our students are considered employees of the hospital. So with that, everything that when we go into clinical, everything that you see in our simulation lab, down to the headboard, the bedside tables, the pumps, all that is identical to what we have in our simulation lab. So maybe right now the student is getting used to the bells and the whistles of a ventilator, or how to suction a intubated patient. Maybe seeing what happens if the patient were to decompensate, or how to give a critical medication. But they're able to do this in a safe environment without a real patient, family, other team members. So this is a really great way to learn some of those new skills in a safe environment, and why we still pride ourselves very much on bedside clinical, and we have lots of it. This is a great way to give new concepts and skills prior to having a real patient and family at the bed. We also have a mannequin that is pregnant and that can birth a baby. So we also do that before we go to our women's health rotation. The Birthing Victoria can deliver a baby that's alive for 6 minutes, that can allow for APGAR scoring, nursing assessments of an infant. The mom can have a postpartum hemorrhage, a shoulder dystocia delivery. So lots and lots of opportunities also on that new specialty of nursing that they're learning. So lots of opportunities with simulation. When you are researching nursing schools, I just encourage you to look at NCLEX pass rates. That's really important. Beebe, we are consistently above the national and the state mean. So that's just really important when you start looking at how prepared students were when they went to take their big test, that big test being the NCLEX. So always a good question when you are researching different programs or looking at their website or maybe doing college tours. What does that look like? Other things we really pride ourselves on are small class sizes. So we start about 45 to 50 students per year. That's really our sweet spot for us to maintain the student to faculty ratios that we want. And we really think that's a good learning environment for our student body. Affordable tuition rates, which many of you, if you are juniors or seniors, you've started looking at what the cost of college is. So we'll talk about ways in Delaware that you can earn a nursing degree for little to no cost. And as I mentioned earlier, we have lots and lots of clinical hours, so more than 1,000 hours of clinical education. This is our graduating class of 2024, so you may see some familiar faces throughout that cohort. So specifically to our program, we are a 2-year nursing program. Prior to that 2 years, our students do 1 year of enrollment requirements. These are the 9 courses that we think that are important to have at a college level to be able to be successful in nursing and have the good foundational skills. So with that, for most of our students in the high school setting, we have a partnership with University of Delaware's Associate in Arts program. So what that means is our students will do their first year of enrollment requirements with the Associate in Arts program at the Georgetown or the Dover campus typically. And they're able to utilize seed money. So that's scholarship money where you can get free education. So year 1, our students are dually enrolled. They are University of Delaware students for year 1, able to use the benefits of the seed scholarship. Year 2 and 3, they then attend our nursing school in Lewis. At the end of the 3rd year, they're graduating with their diploma in nursing. They can sit for their RN boards, pass their boards, and then they go back in the online format to finish their bachelor's degree. So still in 4 years, you can have your bachelor's degree, but you're actually working after year 3. With that, if you are a senior and applying to colleges, University of Delaware's Associate in Arts program for that year 1 is looking for a high school GPA of a 2.75 and a B- in biology and chemistry in high school. So what does our curriculum plan look like? So year 1, you're doing those enrollment requirements. Year 2, you are at the School of Nursing. We start with foundations of nursing, a lot of foundational skills, bedside care, immediately with assessments, injections, charting on electronic medical records. We start clinical immediately. And just for some thought behind that, Beebe went live with Epic, which is electronic medical records this week. And our students were in clinical on Tuesday and Wednesday. So we truly are members of the team, and our students are just as integrated into Beebe Healthcare as anyone else on the team. So it's really fantastic to see. Some organizations or schools even may have blacked out students ever coming when Epic is going live because it's such a big undertaking, but we are there in the trenches and really ensuring that it's going smoothly. And then expanding on that, our next semester is nursing care of adults. So this is where our students are, I'd say this is probably one of the most important semesters when it comes to really honing in on your med-surg skills, your assessment skills. You're giving high alert medicines like insulin. You're going to the operating room. Lots and lots of learning is taking place during nursing care of adults. Every other year, we also offer service learning. So our students are currently gearing up to head back to Costa Rica this January, where they serve underserved areas that have limited access to healthcare. So we do this every other year. So our first year and senior students all have the opportunity to attend if they choose, and also allows us to have time for fundraising. So we are very much supported by Beebe and the Beebe Foundation when it comes to allowing our students with these opportunities. So they are very excited to return this year to Costa Rica as well. Last year, I believe, or the year before last, they helped in a dental clinic. They were building stairs to allow for access. So lots and lots of opportunities to help others with their background knowledge of healthcare. So in year 3 in total, year 2 of the School of Nursing, we then continue in special populations. This is women's health. So our OB clinicals are predominantly at Beebe. Mental health, we do all of our inpatient clinicals at Dover Behavioral Health. And pediatrics, we do pediatric flu clinics. So we run at a local office in Lewis, we run all their pediatric flu clinics. We do child health screenings at local school districts. We also go to Nemours for inpatient children. And also we see them commonly in our emergency department because kids are very resilient. So we see them there. What's unique about our program is our students also learn how to start IVs during this semester. So many nursing programs actually consider that on-the-job training, that you are not allowed to start an IV until you actually are a nurse. So our students probably start about 50 IVs before they graduate from our program. So a skill that they're very confident in. And then our final semester is advanced care of adults. We're in the ICU, the emergency department during our trauma unit. Our students are taking care of multiple patients on the floor, very much transitioning into practice. They even get to participate in a preceptorship where they pick an area of specialty and are paired with a nurse on the floor. And this is really them becoming part of the team. This is a really exciting time because most of them are getting job offers or maybe are doing their preceptorships where they plan to work. So they're really kind of getting off on the right foot to start their career. So after this, you're awarded that diploma in nursing. You can sit for your RM boards. And as you've heard, healthcare has a very big need, specifically in Delaware, even more specifically in Sussex County. So we have 100% job placement. And while Beebe wants to keep all of our students here, they definitely go far and wide and are very marketable. And then our final year 4 would be going back in the online format to earn your bachelor's degree. Most of our students are signing contracts that they'll earn their bachelor's degree within 3 to 5 years. So it's really nice because they're working, so they can use tuition reimbursement from their employer to help offset some of those costs. So we talked about money. College can be expensive. So we know that here at Beebe and in Southern Delaware and Delaware in general, that we have a really fantastic option for those that want to go into nursing, that we know we can give them a fantastic education, little to no college debt, and secure a job upon graduation. So we just really pride ourselves on knowing that with that, we then can have the workforce to help serve our population here at home and in the community. So for year 1, from a cost standpoint, you're able to use seed money for your enrollment requirements. Year 2 and 3, if you completely paid out of pocket, you would pay about $7,500 per year. With that being said, we do take FAFSA, federal funding, third-party scholarships. And as I mentioned, Beebe really supports our nursing school and really want to grow our own. So with that, Beebe actually has a school to work scholarship called the BEST Scholarship, Beebe endorsed student tuition, where Beebe will actually pay for your nursing school with a work commitment upon graduation. So for every 18 months, or for every year of nursing school that they pay for, is an 18-month work commitment. So if they paid for both years, that would be a 3-year work commitment upon graduation. So that doesn't mean you're working for free. You're still getting the same base pay that any other entry-level nurse would receive. But in addition, your perk is that you also had your nursing school paid for. Another scholarship that we offer for high school seniors is academic excellence. So if you have a 3.7 high school GPA, interest in health professions, we award 5 $2,000 scholarships. So that's another opportunity. So I always say, if you have a seat in our class and you're working hard, there is no reason why you should not be earning scholarships. Another really unique program that Beebe offers is between year 2 and 3. We have an externship, so it's competitive. So nursing students from any college can apply for that, and it's paid. And it's a really great way to go into an area of specialty that you enjoy. You're a tech or an aide for 2 days a week, and then you shadow the nurse 1 day a week. So a lot of our students utilize this as really like a job interview, because in a few short months, they're going to be applying for their RM position. And then on the back end, your BSN, what's really nice about this is you're working. So you're using tuition reimbursement from your employer and you can self-pace this. And what I like about this on the back end is now you're working and you're really starting to think about what your trajectory looks like for advanced practice and moving forward. So I know that if I think that I want to be a nurse anesthetist, then I would do my RN to BSN most likely at Wilmington University locally with that partnership, because I know that they have a program in our backyard that offers that. Maybe I'm interested in just continuing being a staff nurse at this time. Delaware Tech has a BSN program. Maybe I know ultimately I want to be a nurse midwife, and University of Delaware has that opportunity as well. So lots and lots of partnerships and collaborations among the nursing schools in the state of Delaware, and specifically for degree advancement. As I mentioned, the best scholarships, Beebe will pay for your school. The Academic Excellence Scholarship, a 3.7 high school GPA. And what are the big ideas? So the big take-home points I hope that I got through to you today were, especially when you're looking at nursing schools and seeing where you are the best fit, that our students here at Beebe are academically and clinically prepared. Again, we really pride ourselves that what we're learning in the classroom, they're doing in clinical simultaneously. We're hospital-based, which is very unique. And this is actually a model that many institutions are starting to resurrect because it makes the most sense to nursing is in need, and why are we not growing our own? Very student-centered. We have a small student body. You know your faculty members, you know the staff here, and you know all the people that we're working with in the hospital as well. So very student-centered, real-life clinical experiences. We have a state-of-the-art accredited simulation lab. Our NCLEX outcomes are always above the national and the state mean, oftentimes the highest in the state of Delaware. The Beebe Foundation specifically supports our program immensely, and we have lots of scholarship and employment opportunities. Beebe is very flexible with our students during nursing school. So if they want to work as a tech or an aide during nursing school, very flexible with, for example, the float pool. So a student may get out of school on a Friday and call over to the hospital and say, do you have any needs? I can work 3 to 7, and they will be sure to grab them for that. We're accredited and recognized nationally for our education quality. We were just, again, redesignated as an NLN Center of Excellence. We have clear pathways for advancement and partnerships with other colleges and universities to continue your education. And it's a legacy. We've been around for over 100 years. So we really do, pride ourselves on the product that we're putting out. If you are a senior and interested in applying, the best place is to visit our website. If you're a senior, the best option for you would be to click on admissions, and there you'll see the application with our dual partnership with University of Delaware. That will require you to make a Blue Hen portal, but our priority deadline is January 15th. And I've been talking a lot. So let me for 4 minutes show you a video of students and how they feel about our program.
I'm excited to welcome you to our School of Nursing. What really sets this school apart is we are a true hospital-based program. From day one, you're considered a Beebe team member. I think that really makes our program special. So we're in this state-of-the-art building right on the Beebe campus. We have these amazing simulation labs where you can come learn and practice in a safe environment, and you're practicing with the colleagues that you're going to work with when you graduate. So everything that you're learning in the classroom, you're learning at the same time by giving patient care and in simulation.
The Margaret H. Rollins School of Nursing is a 2-year nursing program. Prior to that 2 years, our students do 1 year of enrollment requirements at a college of your choice. We have many partnerships and collaborations with local colleges and universities to make this as simple as possible. After your 1 year of enrollment requirements, you transition to our School of Nursing for years 2 and 3. At the completion of year 3, you're graduating with your diploma in nursing. You can sit for your RM boards, start working, and then go back in the online format to finish your bachelor's degree. You can still in 4 years earn your bachelor's degree, but you're working after year 3.
I tried a lot of different things. I was in sales, I was in real estate, lived a lot of life, new mom, and just like, I need a plan. I need a different plan. And I said, what is the fastest way for me to get credentialed and start moving life forward? And Beebe was like a no-brainer. They take a lot of the headache out of it. That for me was huge. They take the time to get to know you. They learn who you are and what's important. I'm a person first, and they understand that there's more to me than just school. Having a tiny human makes it difficult, but it's possible. I have known I wanted to be a nurse since I was 5. My high school instructor went here, and she was just talking to us about how great it was and how she learned so much from just being here. That seems like something I want to do. I want to learn. I'm always eager to learn something new. So my midwifery track came in around high school. I knew I wanted to do something in labor and delivery. I just didn't know what. So just that alone, her talking about her experience kind of pushed me into my own experience. And it was that clicked for me.
The instructor to student ratio is pretty small. The teachers are here for you. It's not about getting you to pass just the class and then, oh, you're done. Like that was just another number. They're here to see you completely out until you actually are a nurse. Going over to the hospital, the biggest group you'll have might be 3 people to 1 instructor on the floor. So you only have 2 other classmates that are getting the help of your instructor. So you're never alone.
You have to come in and be prepared, but if you make a mistake, it's okay. Like that's why we are there and doing so much clinical hours is to learn and get comfortable and feel ready for by the time we're actually nurses. And I think it's actually just really helpful just spending the time like doing certain like mechanics, taking like vital signs, like doing evaluations on patients, doing that in here like with the mannequins they have, I think is really helpful because you're just like getting down the motion and you're practicing. So then when you actually are there at the hospital with actual patients, there's a lot more going on. So if you can have like what you're doing down, it makes it easier with all the other distractions going on. Beebe definitely like helps us be the closest thing like to a nurse right before we start. Like I know that like everyone who's graduated is like competent and is ready to become a successful nurse.
When looking at nursing programs, we encourage you to come look at our School of Nursing. We have so many opportunities right in our backyard. Our graduates transition well into the clinical setting. We have 100% job placements, and nationally and state, one of the highest pass board rates in the state of Delaware.
Beebe Healthcare is growing at a really rapid pace in Sussex County. A School of Nursing is the integral part of that. And so we welcome you to apply to the School of Nursing. We're excited what our future holds. So rest assured, when you graduate, you will be well prepared to start your journey as a professional nurse.
Next slide. So with that, there was a lot of things I said in a abbreviated version, hearing it from students. If you do have any information about our program, email is the best way to get a hold of me. There's also a QR code if you would like to scan that. That really helps me with data and where students are coming from and what schools you go to, where are schools that I should look into that maybe I haven't found. So that's always a really good way for that. And we have a fall open house Thursday, November 20th, the Thursday prior to Thanksgiving from 4 to 6. It's an open invitation. You do not need to register. Anyone who has interest in coming, looking at our program, taking a tour, talking to faculty, students, that's very much an option. And the fun part is next is I have a few students who are currently in our program and what that looks like and some questions for them to really give you some inside scoop on what it looks like to be a nursing student. So first I will give a brief introduction of each of our students, Danny Alfrey and Olivia Creamer, who are seniors, and Marley McMillan, who is a first-year student. Danny, some of you may have went to these high schools that they did and have a similar pathway. Danny graduated from Smyrna High School. She went to Delaware Tech. She chose Beebe for the clinical hours and experiences. And prior to attending nursing school, she had some experience of working in an operating room as a nursing assistant for a few years. Olivia lives in Greenwood. She attended Polytech High School. She did enrollment requirements at the Associate Arts program with University of Delaware. Her career paths have always been in health sciences, but looked into physician's assistant and then transitioned into the nursing role. She currently does work at Beebe at a walk-in as a medical assistant, and she chose Beebe for their strong clinical foundation that she feels is going to support her in her field of nursing. And then lastly is Marley McMillan. She graduated from Milford High School. She earned her bachelor's in public health from University of Alabama. And then she, she wants to be a nurse because you get to provide people with the care they need during difficult times and being able to be a person that a community such as ours can depend on during those times. So it's a privilege to get to experience that when she graduates. So if I move forward, Tim, should I stop sharing for the panel to talk?
Yes, please.
So with that, I'll let them pop on camera, Marley, Danny, and Olivia. And I have a few questions and I will let whoever wants to answer to do that. And if you feel like you have anything else you want to add, you certainly can do that as well. But the first thing I said, or I think would be a good starter is, how did you prepare for nursing school while you were in high school? So many of these are high school students. So what are some recommendations that you may have for them in high school to prepare them for the world of nursing school?
Hey everyone. So I went to Polytech. I actually see in the chat someone else said go to Polytech as well. I was in the medical assistant program, so I came out of high school certified with a medical assistant certification. In high school, I would say take as many anatomy and physiology, biology courses, anything that's sciencey or health related, to kind of build that strong foundation. I did notice that it reflected in the first year Foundations of Nursing course. So I definitely think that would be of help. And then if you can, if you're certified, even if you're not, try and get a tech position at a local hospital, or even an outpatient clinic, just to get some hands-on patient care experience.
Thank you. I think that's excellent recommendation. I agree. I think sciences, if CTE and pathways are very heavily pushed into many of the high schools in Delaware. So I think always, if you have a health professions or an allied health pathway and that is your interest, also sciences, take as many sciences as you can. Another question, what surprised you the most when you started nursing school? Let's not intimidate them either.
I think what surprised me most is how much you actually learn. Obviously you go to learn a lot, but you are learning about every body system, almost everything about everything. You learn a lot, and you learn a lot about yourself, about how much you can learn.
Good answer. Marley, I think this will be thrown towards you a little bit more, but Marley has a bachelor's degree in public health, I believe, right? From University of Alabama. So what made you pursue nursing after obtaining your bachelor's degree?
I think I really desired working in that clinical environment. As much as like I really enjoyed my background in public health, I just don't think anything can replicate the amount of clinical experience that you get, especially at Beebe. So I knew that like when I graduated, I was like, I want to work clinically. So I was like, I know that the fastest way that I can get my hands like on patients was applying to Beebe. So that's what I did.
Very excited. And Marley is an example too. Many of our students have alumni or siblings or parents that we've been around for a long time. Some even have multiple generations of family members that have came through our program as well. So that's kind of cool to see as well. I know I followed my sister. So, and like you, people probably the same faculty members here remember your mom. So I had to break out of a mold because I was after my sister. So it's kind of funny. What is your favorite clinical experience, or have you had this like amazing clinical experience or memory that has really been impactful in your practice so far? And I can have more than one answer for this because you all may have a very impactful answer.
The last semester in nursing care of adults, I was on the clinical decisions unit with one instructor. Her name is Dr. Beige. Clinical decisions is kind of like the holding hallway for ED admits, seeing if they're going to be admitted or if they're going to be discharged. I had a client with Parkinson's disease. He rapidly declined during my time of care, and he was put on comfort measures by the end of my day. It was a very surreal experience, just finding or seeing someone kind of transition into the end of life and caring for them and also caring for their loved ones. And I think that really created a strong interest in hospice care, palliative care, and ICU care that I don't think I would have thought I'd be interested in if I hadn't had that experience.
Sometimes the experiences that you never realized you were going to get are the most impactful. Oh, Marley or Danny, do you have any experiences?
My favorite has been this semester with the population mental health van. I think what Beebe's doing is like truly amazing, helping people in underserved areas that might not be able to get help if it wasn't for that.
Yeah, a huge umbrella of nursing is population health, and we just have so many opportunities, specifically in rural Southern Delaware, of being able to go into these communities and these pockets of areas that really have a lack of access to care. So that's fantastic. Marley, you're still in your first year, but anything so far in this semester? We start clinical immediately. So anything wild happened for you so far that's been impactful?
Earlier today, I had an observation at South Coastal Cancer Center. I never saw myself like working in oncology, or in an area like that. But the nurse that I observed today, she did a really good job with turning an environment like that, like receiving like chemotherapy drugs, kind of like almost like taking the patient's mind off the fact that they're receiving, therapy like that, and just putting a smile on their face and like making them like really comfortable in that environment. And I really enjoyed like witnessing that today. So it was a good time. Yeah.
And I wish we had this again, so you can even tell me a year from now, like if this moment early on in your clinical and nursing school education is something that maybe impacts the trajectory of nursing that you pursue. So that's really cool. Other things in real life when it comes to clinical and nursing school, how do you handle nerves, or maybe even while at Beebe, your faculty are always there and they will always be your safety net. How do you handle any nerves or mistakes when you're in that real clinical setting? What are some ways to help you?
I think in the real clinical setting, being with your classmates always helps me. We all sort of lean on each other. If no one, is 100% confident, we talk to each other, and if we need help, we ask our instructor for help, and you guys are always there for us.
And I think that is also a big cornerstone of our program, is that your faculty are there. If you like look left and we're not here, you probably just need to look right because we're on the other side of you. And some, other clinical experiences may not always have a faculty member readily there to help you with everything. So I also think that's a big strength. What advice would you give to a high school student who's thinking about nursing as a career? You mentioned sciences, tech areas. Anything else crucial, you think? Volunteering, clubs.
I would definitely say like staying involved like at school, like being in extracurriculars, like things like that. I feel like those facilitate really good like communication skills because you'll learn like your first year of school that communication is a huge key for patient safety. So like learning how to communicate like with your peers can facilitate how to communicate with your eventual coworkers, instructors, bosses, just to overall like make things efficient and like keep patients safe.
Excellent. Last question. What do you wish more people understood about what nurses actually do? Is the same perception when you came into nursing school the same perception that you have now when it comes to nursing and what they do?
A lot of people don't realize the autonomy nurses have. I think they maybe have this perception that they just follow orders that physicians or advanced clinicians put in, but really it's not. And I think we've seen that firsthand in clinical. You really are driven to implement your own interventions quickly too, based off of your client status, and you don't need orders for everything.
Anything else from Marley or Danny that you want to add? Or any global things that you would give advice to a high schooler who obviously is already putting in the work and participating in this type of event after school? So that's fantastic. But any other closing points on why has maybe Beebe been a good fit for you, or this nursing program been a good fit for you?
I think this is a great fit for me personally because you're in the classroom with a teacher being taught versus getting stuff sent to you and having to go over it yourself. You guys, all teachers are always there for you. If you have any questions, anything like that. I like the involvement at Beebe.
I agree with Danny, definitely like being while there's like the classroom element, some people get tired of being in the classroom all the time. Sometimes people just don't learn like that as much as like the academic and like book component of school is really important. The clinical aspect might be really important for certain students who learn hands-on that way.
Well, thank you all so much. I appreciate you really bringing it home with the panel and really giving students the feedback that they really want to hear from students who are very close in in their shoes. So thank you so much. And I appreciate your time and effort. And I will give it to Tim to see if anyone in the audience has any questions.
Oh, yeah.
Oh, good thing we're on a time crunch.
Oh, yeah. No, it's all good. Let's go ahead and I'm trying to get myself organized here. All right, so let's do a little screen share first. And let's go to those questions that you weren't able to see. Are you able to see them now?
I can. Oh, fantastic. So, day in the life of a staff nurse. A lot of you mentioned compassion, patience, communication, understanding, empathy. Yeah, those are all really great qualities that make a nurse.
Right. And then the other question was about the 5 rates.
Yeah, something very bad could happen. That was definitely the key point, and the big thing is patient safety. Perfect.
Right. All righty. So with that done, I'll go ahead and ask the first question, and I'm going to go all the way back up to the top. So Olivia asked, can students help deliver babies? So nursing students.
Yes, so our students are fully integrated into the clinical setting. So during their OB rotations, they get plenty of experiences to follow a mom and a baby. And with that, they could be in a delivery, a spontaneous delivery, or they could be going to the OR and being able to participate in a cesarean. So they're not always the one catching the baby, but they are definitely involved in the room during this event. And unique story, a couple years ago, we actually had a patient who named their baby after the nursing student. So,
Oh, that's cool.
yeah,
All right.
really cool.
Question from Giovanni. Does a nurse have to go through special training to be a military nurse, or is it just regular training?
Yeah, generally speaking, I can't necessarily speak for the military, but generally speaking, everyone gets their RN license. So whether you're a diploma, associate, or bachelor's degree prepared nurse, you take the NCLEX, which gets you your RN licensure exam. And then from there, you specialize in other areas. So I'm sure the military has their own nuances on providing, education for people to become nurses and then going back and working. Actually, a faculty member here was in the Army, and she was a respiratory therapist in the Army and then went back into nursing. So definitely there's opportunities there, but I cannot necessarily tell you all the specifics.
All righty. So not asking for you to divulge your age, but what has been the elapsed time between when you graduated from high school to where you are now as a nurse educator?
Yeah, the elapsed time. You want the so for me, no, I graduated from Sussex Tech in 2007. I graduated from Beebe School of Nursing in 2010. I had my bachelor's and master's in 2013. I had my doctorate in education in 2017. I only know because I'm looking in my office right now. So with that, throughout that, I've always been in emergency medicine throughout all those years. And then I started the school of nursing part-time for a few years, just doing clinical. And then from there, I evolved into a full-time role, which then evolved into recruitment with nurses. So I'm still in the classroom, I'm still in clinical, but I also have a unique schedule where I go into the community and local hospitals and talk about nursing. So that's really cool in that side of my job as well. So I'm never in the same place. In the fall, I do clinical in the emergency department. In the spring, I do clinical, typically our clinical decision unit. I've always been with seniors. I hope I don't jinx that. I love being with the senior nursing students. It's really wonderful to see them towards the end of their journey. And a lot of them, I met them in high school when I was trying to recruit them. So now I see them a few years later when they are graduating and they really are the nurse. And also me working still in practice, it is really fun, truly, to go and work with my graduates. So I do that commonly because our graduates are everywhere in the community, at every organization. So it's really, interesting for them to see me as Dr. Watson and now I'm Allison, which is a really big transition for them.
Right, right. So Kanabari asks, are nursing skills useful for surgeons, specifically neurosurgeons?
I mean, if the question is from a standpoint, there are nurses that specialize in neurology. There's neurology nurse practitioners. When you go into the OR, there are specific nurse practitioners and higher level of care that may be utilized in the OR, or there's nurses that specialize in the OR that they're an OR nurse, but now maybe they have a special interest in neurology and they're with all the neurology cases, or they're in all the orthopedic cases. So you will see that OR nurses do specialize into areas of interest. When it comes to skills of nursing school, we give you a taste of everything. So you learn a little bit about a lot. And then from there, you can go and hone in with continuing education, work experience on areas of interest like neurology.
Okay. Gabrielle asks, excuse me, are there websites or people you would recommend to start preparing for that test? And I think maybe that test was the NCLEX.
The NCLEX. We prepare you for the NCLEX. Throughout nursing school, you get many, many opportunities to take NCLEX style tests, and we have lots of resources through our organization and through our program. Specifically, we use ATI as our partnership of who we use for NCLEX style prep, but there are lots of other resources like Lippincott. What book am I looking at right now? The Lewis MedSurg book, all these type of companies that really do have lots of NCLEX style prep. And what I've noticed now is with the use of AI, a lot of our students use Chat GPT to help study. So you can go into Chat GPT and write, make 10 NCLEX style questions about medical surgical nursing. So there's lots and lots of resources when it comes to that.
Cool. Hannah asks, if we plan to be a nurse of mental health major, do we need to learn first aid skills like in the picture? And I'm thinking that might have been one of the sim lab pictures.
Oh, so yes. So all students go through every specialty. And so you might not even realize that you think you love mental health now, and you might really go into mental health, but you will notice as a nurse, there is mental health in every discipline of nursing. So specifically, even in OB nursing, there is a high rate of mental health. In oncology nursing, there is mental health. In pediatrics, there is mental health. So for our students, they are exposed to mental health. They actually go to on the community population health RV into areas that have mental health. They follow mental health nurse practitioners. They follow our behavioral health inpatient nurses. They do inpatient clinicals. So you're able to see all the different exposures. We had a new graduate last year who actually had a very big interest in mental health, and she actually was hired as a new graduate into our behavioral health nurse team. Others, then there is a mental health nurse practitioner pathway as well. So if you start expanding into that, but yes, you still have to have all the foundations of being a nurse before you can go into mental health, because you will see mental health everywhere.
Alrighty, and a couple of, well, they're sort of an expansion on one question from Sherry. And basically she's asking, so she's an older adult learner. She's saying, what does the path look like for somebody older, some college, but not college in nursing, and that her BA is not in nursing? So what's her trajectory look like?
Yeah, so for our program specifically, students can truly do their enrollment requirements at any college that they choose. So locally for us, most students complete those 9 enrollment requirements at Delaware Tech or Wilmington University. Both of them offer all the courses we have, and we have partnerships with them. So that's where you have to start, is apply, take those 9 enrollment requirements. And then students that are considered transfer students, so meaning that they are not coming from our dual enrollment with University of Delaware, they also are required to take a placement exam called the TEAS exam, which is very popular in nursing schools. So that is one thing that we do require as well for students that are not coming from our dual enrollment.
All right, a couple of class specific questions, so I'll group them together here. Does chemistry help in your nursing career? And
Yes.
so she didn't ask, or they didn't ask, whether it was organic or inorganic chemistry, but that was the first one. And then the second one is about anatomy and physiology, and whether or not they should separate the anatomy and physiology classes outside of, the regular education. Fire away.
So with that, I think a high school chemistry is important. It's your foundation for a lot of your science courses. We don't require a college chemistry, but high school chemistry is important. And I know that's not necessarily a requirement to graduate from Delaware high schools anymore, but most students that are in a pathway for allied health or health professions, their school counselors are very good about making sure they're taking a chemistry. So I think you should always do that. When it comes to anatomy and physiology, many Delaware high schools have dual enrollment with Delaware Tech, where you're taking Bio 110, which is Essentials of Anatomy and Physiology, or even Bio 120, which is A&P 1. I think that's fantastic. I think it's really giving you those core understandings that you need to know. But I also think that when you're in college, your lens looks a little different too. So no matter what, I think you just need to really focus on doing well in your anatomy and physiologies, because that is the foundation of nursing. If you don't understand and have a strong sense of normal A&P, once we start adding layers of disease process, complications, I used this example today in a high school. For example, if you don't know the normal process of the respiratory system, and now we're adding a patient that has pneumonia or has a pulmonary embolism or has congestive heart failure or has a pneumothorax, and how are you going to understand the disease process? So A&P is crucial. And a lot of students in Delaware are afforded the opportunity to take it in high school.
All right. So we're going to go into lightning round because we've got 8 minutes and 21 questions. So I'm going to kind of go through these. Empress S, do you work with pediatric nursing as well, or just regular nursing?
In nursing school, we work with both. And me in my professional career, I work with both. I work in emergency departments. I see baby to death.
All righty. If the students are taking AP courses, do the college credits transfer if we attend the Beebe School of Nursing?
Yes. If you are awarded credits, they are transferred.
All right. Dia asks, and I don't even know what this means. I'm old. What does Bio 115 help? Does Bio 115, I guess that's a course number?
I don't specifically know what Bio 115 is. Bio 110 is Essentials. Bio 120 is AP 1. So I'm going to guess Bio 115 is something in the middle. So if you are able to take that, then certainly I'm sure it's helpful.
I love it. Okay. I saw a question there about is being a CNA first an okay trajectory?
Yeah, I think that being a CNA, and a lot of our students who are able to earn their CNA in high school flourish in our program, because most of those high school programs that have CNA opportunities are really, their curriculum is derived just like a diploma program. It's hands-on, and they actually get basic care and hands-on experience. We have students that come to nursing school who have never touched a patient before, who have never been in a clinical setting, but they think they want to be a nurse. And many of them are successful. But the students that have their CNA, they've done the clinical requirements, they've done the skills checks, they are truly, really prepared. So I'm a huge proponent of CNA. It's not necessarily required to start, but now in Delaware, I know Sussex Tech Adult Ed is going into many of the local high schools and allowing students to have opportunities to get their CNA. A lot of the technical schools, even schools that aren't technical schools, have pathways for CNA. So if you are able to get it, I think it's a really great experience. If you don't have it and you go into nursing school, we also have opportunities where you can be like a tech on the floor, where we actually do the on-the-job training for that.
All righty. Again, I'm trying to tease out some of the unique questions. Oh, here's a great one. Why do most nurses work 12-hour shifts? How do you deal with the workload?
Yeah, that is the beauty of nursing. While most inpatient units are 12-hour shifts, that is the continuum of care. I think if we work shorter shifts, you just can't get it all done. But that is, most nurses who work 12-hour shifts actually want to work 12-hour shifts, because you work 3 12-hour shifts a week. So you're working what a full-time workload would be in 3 days. But then that gives you the flexibility in your schedule. But a lot of it is just for continuity of care. We talked about bedside report and handoff. That is something that if you gave a handoff every 8 hours or every 6 hours, I think there's a lot of errors that could happen in nursing just by not having the continuity of care. But certainly with that being said, there are many disciplines and specialties in nursing that aren't all 12-hour shifts. You might work at a surgery center. You might work as a school nurse. You might work in population health, where you're going out at 1 p.m. to the Pallet Village in Georgetown and getting off at 9 p.m. So lots and lots of flexibility and different hours. And that's also what's great about nursing, is depending on where you are in your life. I work 12 hours when I work in the ER, but outside of that, my my Monday through Friday gig looks different than that.
Right. And I'm answering a couple of these easier questions just to try and get through everybody. Would we be able to join the program if we aren't currently taking a nursing course?
As in high school, yes, certainly. You know, the big thing is our students need those 9 enrollment requirements done before coming to our program. So your best interest, if you have interest, is to apply or communicate with us and reach out, and we'd be happy to really help you navigate what you need to do next.
Right, and everyone in the chat, I dropped Allison's email address for you.
Great.
Let's see. I heard that as medicine is progressing, one physician anesthesiologist is looking over 2 to 3 certified registered nurse anesthetists in hospitals across America. Can you talk a little bit about this? That's a lot to unpack.
Yeah, I can just say, generally speaking, nurse anesthetists have a very similar scope of practice as an anesthesiologist. Many nurse anesthetists are now doctorate prepared. They can give all the same medicines, have all the same autonomy. Just one went to medical school and one went to nurse anesthetist school. We have a nurse anesthetist here that would be much better at that discussion on the differences between the two and the equalities or inequalities among the two in the workforce, but nurse anesthetists are very much utilized and very much in need. Hence why Wilmington University has just developed a program, because they're very much in need in the state of Delaware.
Right. I'm going to take an opportunity here to answer a question for Natalie. How could I become a No, that's it. Where did it go? Oh gosh, that's funny. It was there and then it's gone. Maybe Christy got it. Okay.
How could I become a cardiologist nurse practitioner?
Right. Oh, that's the one that disappeared. Right. So what we find in medicine overall for all you students out there is that you might come in with a real clear picture of exactly what you want to be. I thought when I was younger, I wanted to be a pediatrician. I didn't end up being a physician. However, the rule of thumb can be that you can certainly come in with a determined, possibility endpoint, but be flexible, because as you're exposed to the wide variety of things, you might find that what you thought was going to be interesting isn't as interesting as you'd hoped, and that something else really grabs your fancy. So anyway, sorry for interjecting myself into the answers. Is a nursing degree a good substitute for pre-med?
No. Nursing's hard. The nursing major is hard. If I was going pre-med, I would never do a nursing degree. I do know a physician who was a nurse first and then went to medical school a little later. But if I knew that my terminal end goal was to be a physician, I would do some type of pre-med biology degree path, personally.
Right. Okay, we're coming down on 1 minute. Oh, here. I'm going to say her name wrong, but Dia asked a really good question. Is there anything you wish the doctors would change for the nurses? And the answer could be no, nothing.
No, I've worked at Beebe, as you know, for 16 years. We are a community-based hospital. I work with a lot of really great providers that also live in our community. So I think that is the best thing. It's just developing those rapports and that autonomy with your providers. And that's crucial in that relationship, because they're relying on you as much as you're relying on them. So I think we're very fortunate with the community-based physicians that we have, but then we're also in very close proximity to some of our higher levels of care. So offhand, I can't think of anything I would change in particular, but it's a very rewarding and unique profession.
All righty. Well, we are at the hour. Thank you very much. Thank you to your nursing students who joined us. Not sure whether they're online or not. I'm sorry we didn't get to all the questions, but I think we got to a lion's share of them. Next week, we're going to hear about the growing role of the advanced practice clinician, APC, and that's going to be presented by Amanda
Conway, I believe. Yeah.
Amanda Canoyer. See y'all later. Thank you very much, Doctor.
Thanks, Tim.
Bye.
Thanks, Christy. Thanks for having me.